Let me move now to the impact of this policy of violence against civilians and what happened inside Syria and how the communities dealt with this issue. And this is a quote from one of the doctors in Aleppo, whom I met in 2013 at the peak of the barrel bomb campaign. And I asked him, what can we do to help? And he said, send us coffins, we ran out of them. And as we see, the percentage of or share of Syrian civilians who are the victims of violence has increased over time. And at one point it was about 90% of the people who are dying in Syria. So the majority of people who are being killed are civilians. The share of women and children also is increasing. About 35 or 40% of the people who are dying in Syria are civilians and a large number of them are women and children. And they die with all kinds of weapons, explosives, and chemical weapons, which led to the death of not that large number, but led to displacement and fear and mental health issues. Siege also are affected many civilians, shooting and detention. So this is the percentage of civilians who are the victims of all of these policies, and also the percentage of women and children among the victims. One of the articles I wrote also in 2014 about the impact of barrel bomb campaign on civilians in the city of Aleppo. I invite you to read it if you are interested. It's very graphic. And this is one of the victims of the crisis in Syria. This child, his name is Ahmad Hijazi. He's 4 years old in the city of Aleppo. I treated him in the intensive care unit, which was built underground for protection of the hospital. He lost his family, and at that time he has shrapnel in his neck and in his chest. We had to put him on the ventilator. The road to Turkey was very dangerous. We were not able to transport him to Turkey. He stayed in the intensive care unit for 4 days. There was no CT scanner to tell us if he has any intracranial bleeding, and then he died. This is one of the thousands of victims in Syria that you don't hear about, you don't see in the media, and his name is Ahmad Hijazi. One of the major things that happened in Syria that the Syrian regime deployed or implemented a policy where he attacked doctors and the healthcare centers. And you're probably familiar with Article 19 in Geneva Convention in year 1864, which says that medical units may in no circumstances be attacked. Medical units in Syria have been attacked in many circumstances. This is one of the hospitals that I visited, completely destroyed, Al-Kindi Hospital near Aleppo. As you see, an ambulance was also attacked. These are the number of attacks on healthcare facilities in Syria. Number of doctors, nurses, medics, pharmacists who were killed. The largest number, of course, among healthcare professionals were physicians, followed by nurses, then medics, then pharmacists, medical students, and so forth. This is Al-Kindi Hospital before the crisis, and this is the Al-Kindi Hospital after it was destroyed by both the regimes and the rebels. And these are the numbers of attacks on healthcare, according to Physicians for Human Rights, from 2011 through 2018. It continued, of course, in 2019 and 2020. And we are seeing now, especially in that last year, acceleration of attacks on healthcare in the province of Idlib. This is the mode of attacks on healthcare every year. The majority of attacks happen now from air, with barrel bombs or with missiles. The entity that is responsible on these attacks are mostly the Syrian government forces, followed by the Russian forces, or combination of the Syrian and Russian forces, which is actually quite heartbreaking that in the 21st century we have a government that is killing doctors and nurses and attacking hospitals and ambulances just because they are providing healthcare to its own population, and that we have a member of the United Nations Security Council that is aiding this government in attacking hospitals. So according to Physicians for Human Rights, as of August 2020, there's 923 medical personnel who've been killed in Syria, 91% by the government forces. On average, a medical worker is killed in Syria every other day since 2014. Physicians for Human Rights documented 595 attacks on 350 medical facilities. 90% of them are by government forces. This is one of the die-ins that we organized in New York City near the United Nations headquarters, representing the doctors and the nurses who were killed in Syria. As we know, targeting a hospital is a war crime. The government also employed the siege as a tactic in the peak of the siege against areas that were controlled by the opposition in Ghouta and other places. There were about 4 million people under siege. According to the UN, only 3.6% of the population needs were met. There were increased rate of severe and moderate malnutrition among children. Vaccination rate dropped from 99% before the crisis to 25% in some of these areas. 60% of pregnancy ended up with C-section in some of these areas because of the violence and the shortage of healthcare providers. Quantities of food has been grossly insufficient to meet the needs of the population. Even medical supplies and nutritionist food that were sent by the UN convoys, including surgical sets, atropine, which is antidote to chemical weapons, vaccinations, vaccines, baby milk, and meat, were often removed from aid convoys by the government security forces, according to the UN. And this child is one of the victims of the siege in the city of Madaya.
طيب ما عم تلاقي لها شيء طعميه اياه ولا رز مسلوق ولا نشا ولا اي شيء. قديش عمرها هي الطفله؟ لا حول ولا قوه الا بالله. يلا بسيطه اختي بسيطه ان شاء الله الله يخلق فرج.
Let's move a little bit to a different, also very difficult topic, which is the use of chemical weapons in Syria. Nowhere to Hide is the title of a report that describes in details the use of chemical weapons in Syria. All kinds of weapons were tried on the Syrian population, including prohibited chemical weapons. And according to the Global Public Policy Institute, which had detailed all of these attacks and confirmed 349 chemical weapon attacks in Syria, 349. More than 2,000 people were killed and 15,000 were injured. And this is a small number, of course, compared to the large 500,000 to 1 million people who were killed in Syria. But still, the impact of chemical weapon was very unique in terms of the fear, in terms of the mental health problem, in terms of the displaced. The major impact was, of course, strategic advances on the ground by the government troop in the area that they were attacked with chemical weapons. There was large-scale displacement of the civilians and long-term psychological trauma. I mean, I met with some of those people who survived the gas attack in Khan Sheikhoun, in Sarmin, in Idlib, in Ghouta, and until now, and these are young people who are, I mean, very resilient. When they talk about their experience, they cry. They clearly, all of them, have signs of post-traumatic stress disorder. So what happened in these chemical weapon attacks stays in life with the people who were affected or witnessed what happened. The first confirmed attack happened in the city of Homs in December of 2012. The last confirmed attack happened in Idlib in 2019. The red line, the famous red line by President Obama, was in August 20th, 2012. President Obama at that time said, "We're not going to intervene in Syria, but the Syrian government should not be using chemical weapons." mean, that was very famous quote, a red line. He said, "This is a clear red line for us." The Ghouta massacre, which is the largest use of chemical weapon that led to the death of about 1,400 people in the area around Damascus in Ghouta, happened in August 21st, 2013. And the red line was broken at that time. There was no response by the United States. 90% of all chemical weapons happened after the red line was broken. The UN Commission of Inquiry and the OPCW, which is the Organization for Prohibitions of Chemical Weapons, confirmed the use of chemical weapons in many instances. 98% of all chemical weapons attacks attributed to the Syrian regime and 2% to ISIS. Sarin gas, chlorine gas, which is a choking agent. Sarin gas is a nerve gas. Chlorine gas is a choking agent. And mustard gas, all were used in Syria. The UN Joint Investigation Mechanism, or JIM, assigned responsibility in these attacks to the Syrian regime in 4 out of the 6 attacks that it investigated in 2016, and assigned the responsibility to ISIS in 2 out of these 6. The Organization of Prohibition of Chemical Weapons, OPCW, assigned responsibility to the Syrian Air Force in 3 chemical weapon attacks it investigated in April of 2020. And no one is held accountable until now. Chemical weapons, of course, are heavier than air. So the reflexive thing that when civilians hear a helicopter in Syria and they associate that with barrel bombs or with missiles, that they go to the basement or the lowest part of the building. And when there's chemical weapon use, of course, that will not help. That's counterproductive because chlorine and sarin will go down. It's heavier than air, and people who are in the trenches, of course, and the basements and the shelters will suffocate. These are the areas that chemical weapons used in Syria, the majority around Damascus, then followed by northwest of Syria and Idlib and north of Hama and Aleppo and other places. Majority of chemical weapons used were chlorine gas, followed by sarin gas and others. 98% were used by the Syrian government, 2% by the Islamic States, and these are the incidents of chemical weapon use in Syria up to 2019. Because all of these policies, the indiscriminate use of violence against civilians, chemical weapon use, the deployment of siege, extreme torture, we had an influx of trauma cases in Syria, patients with polytrauma, victims of crush incidents due to barrel bombs, amputations, and other injuries related to use of missiles and bombs and bullets, disabilities related to war injuries, amputations, and dislodgement of shrapnels, and so forth. A shortage of medical supplies and human resources because physicians and nurses, some of them have fled. According to the WHO, about 50% of doctors and nurses in Syria fled the areas that were the center of violence, and that led to shortage of course, human resources, and also shortage of medical supplies and medications. Had epidemics of infectious diseases, including polio at one point and others, malnutrition in areas under siege. The NCDs, non-communicable diseases, were not dealt with by the population because they were not able to afford to purchase their medications for diabetes, hypertension, COPD, and asthma. We had a mental health crisis because of the trauma. We had drop in life expectancy, as I've mentioned, a deterioration of women health benchmarks, disintegration of the public health care system, which actually lately have been highlighted by COVID pandemic, which proved the fragility of the healthcare system in Syria. We had thousands or tens of thousands of deaths related to COVID, although the official number is only a few hundred. But when you talk to physicians and when you talk with the public, the numbers are much higher than that. And then until now, there are about 70 doctors. Many of them are senior physicians who died because of COVID. And I'm talking about government-controlled areas. So this COVID pandemic has highlighted the fragility of the healthcare system in Syria. This is a graph by the World Bank about the drop of life expectancy in Syria. At one point, 2014, it's similar to the life expectancy 29 years earlier. We had a epidemic of polio in 2013 related to the drop in vaccination. We had also increased number of patients who have tuberculosis because of the disruption of diagnosis and treatment. I asked one of the doctors in my last medical mission to Syria, in the northwest of Syria, in Idlib province, what would you like us to do in the US? And he said, just pay attention to us. So what has been done to improve or build resilience within the local communities and to prevent further displacement? So the most important thing, and the first thing, was to provide humanitarian and medical aid to the population. How can you provide aid if the regime is actually dropping bombs on the population and preventing aid to areas under siege? So we had to do it in creative ways, using what we call it cross-border humanitarian relief. Initially, we had a group of smugglers who smuggled medications and medical supplies, suture sets, blood bags for blood transfusion from Turkey, from Jordan, from Lebanon. And then the United Nations Security Council approved a resolution to make cross-border relief legal through different border crossing from Turkey and Jordan and Iraq to different parts of Syria, to basically provide aid to millions of Syrians who you would not be able to provide aid through Damascus or what's called cross line. So you have to provide it across the border from neighboring countries. UN OCHA organized and coordinated the UN deliveries through local NGOs, including ours, through approved border crossing from Jordan and Iraq and Turkey. At one point, we had 5 different border crossings from these countries to areas inside Syria. In the last United Nations Security Council resolution, Russia has vetoed most of these border crossings, and now we have only one border crossing from Turkey called Bab al-Hawa that provides humanitarian assistance to northwest of Syria, where you have 4.2 million people. Half of them are displaced from other regions who are dependent on humanitarian aid. So we have this bottlenecks now of providing assistance or humanitarian aid through the UN through one border crossing. Of course, to deal with the limited resources and austere environment, so we had to train, and actually many of the Syrian physicians and the local health authority can now train us on how to deal with limited resources through preparation, planning, substituting certain medications and medical supplies with others, adapting to the situation by using certain ways to generate electricity. For example, in some areas under siege, electricity were provided through methane gas, which is provided from animal extracts and waste, and that was converted to methane, which was provided energy for generators because fuel was very scarce and expensive and there's no electricity. Conservation by using less of supplies and medications to extend the time that you have these supplies, reusing certain supplies, and also reallocating certain technology and supplies to provide care for the patient. So all of these principles of dealing with limited resources were deployed in the Syrian context. This is a picture of a surgeon, a young surgeon who's doing surgery under the flashlight. This is one of the emergency rooms that I visited, and they're using sandbags to prevent the shrapnels. And there's all kinds of creative and innovative ways that were used in Syria to deal with limited resources. We use telemedicine to connect to hospitals that are in areas that are difficult to reach in Syria or that are dangerous. So simple camera monitors, of course, and internet was provided through satellite internet and you can talk with the physician in this hospital in Aleppo or Idlib, and you can look at the patient, you can talk with the physician. It compensates for shortage of specialists, 24 hours coverage. You can provide direct consultation using available and cheap technology and communication, nothing very sophisticated. It's creative solutions for areas that has no internet or electricity. And it increased resilience in these areas to prevent displacement. It has short-term and long-term impact in terms of saving lives and providing the right medications, the right principle of treatment. And it allows for rapid deployment of international intensive care unit services to areas in disaster. And this is one of the resources that you can look at, was led by Dr. Anas Moghrabiya, who's a Syrian American critical care specialist who invented this way in telemedicine. We use technology. We trained physicians in Syria to use portable technology, point of care testing, portable ultrasound, iStat, and handheld blood analyzers, creative ways of communication, even creative ways in providing dialysis when you do not have dialysis units, and also to start a blood bank with very limited resources. And this is one of the portable ultrasound. It's a V-scan. We trained physicians in Turkey on how to use V-scan or portable ultrasound, and we donated many of them, and they brought them inside Syria and they use them. This is one of the patients I've seen in Aleppo in the OR, and this physician was trained, and now he's using the V-scan to look at the heart of this patient who has polytrauma. Training was very important. Training the trainer. We did courses, training courses in neighboring countries, especially Turkey and Lebanon and Jordan. We also did training courses inside Syria in border towns. We used webinars online for training, and the training focused on disaster management, chemical weapon response, using different antidotes to different chemical agents, surgical principles in conflict and polytrauma patients, dealing with limited resources, infection control. We also did courses, modified ATLS, ACLS, and BLS courses, new resuscitation methods and techniques, and of course, using of ways to provide blood and fluid early in the patients in the field. The intraosseous needles, we donated large number of needles. That's the first time that IOs were used in Syria. We also provided training on mental health, first aid, and other places. These are medical students in Ghouta, which was under siege. And you have Dr. Atasi here, who's providing this lecture to these students. He's based in Chicago. And these students are in an area that at that time was under siege by the government. And there's no electricity there. So they're using car batteries to provide electricity for the computer. And we provided them with satellite internet, of course. One of the ways that physicians and local healthcare providers dealt with the bombing of hospitals and the indiscriminate bombing of civilian centers is by building underground hospital system. And this is an amazing system that I haven't seen in any other country that are going through disasters. So some of these hospitals were built in basements of buildings, of course, for protection of doctors and nurses and patients. But it became the norm because of the systematic attacks on healthcare. It, of course, lacks standards. It has different forms. You have basement of buildings or unidentified buildings that were transformed into hospitals, and there's nothing from the outside that tells you that this is a hospital, like Chicken Farm, for example. Some of these hospitals were in caves, were built in natural caves, and I'll show you some pictures. And many of them were built underground, so 2 or 3 floors underground to prevent injuries when you have a missile or barrel bomb. Some of them were built away from urban areas to prevent injuries to the civilians who are living in the same neighborhood. Some of the villages asked the hospitals to move away from the village because they did not want the villagers to be injured or killed when when they know that the regime will come and bomb these hospitals. Some of the also public hospitals were fortified. This is one of the articles that we wrote about the Syrian field hospitals and how was it used as a creative solution in urban conflict. Dr. Hassan Al-A'raj, I met multiple times in the training courses. He's a cardiologist from the city of Hama, and last time I met with him was in 2014. I visited him in his hospital that he built, and he was taking care of a patient who has a regular heartbeat. She was a middle-aged woman from his village. And he was very proud of his hospital that he built during the crisis, monitors and ventilators, and this is the patient, of course. And this is inside the hospital that was built inside a cave. It's amazing. He wanted to transform this cave, which called this hospital called the Central Cave Hospital in Syria, Mashfa al-Maghara al-Markazi. He wanted to transform it after the crisis to a museum to show the world the extreme that doctors in Syria went through to provide care to the local community and build resilience. This is the hospital entrance. This is a ventilation unit. It's amazing. It's amazing. Unfortunately, Dr. Hassan Al-A'raj was killed with a heat-seeking missile that was fired allegedly by Russian airplane when he was leaving the hospital a couple of months after I saw him the last time.